Mm-hmm.
Okay, so before having my hip replacement surgery, I was given a lot of information and pamphlets to read about what to expect. And one of the biggest risks that was mentioned was the fact that your hip can dislocate after surgery. Though only one of the nurses I'd spoken to had ever seen it in a patient, and that was in an elderly woman. But nevertheless, the risk was quite real, or the fear of it was, and I made sure to do everything by the book. So one of the things they said was, don't lift your knee above the height of your hip. And if you were going to have your feet up, make sure your feet were lower than the hip. Another thing was, make sure you don't bend forward like this, because the hip might dislocate, or don't cross your legs. So when picking up, and don't squat down, so when I needed to pick something up, I always tend to put my leg behind me and then pick it up like that. Another thing is going to in bed. They tell you to sleep on your back with a pillow between your legs, and that's fine because that's a comfortable position. Because if I rolled onto my right side, which is the operated leg, it's too tight, and there's too much pressure on the wound to lie that way, and I was always scared to then lie on my left side in case in the night the leg might fling itself around on its own accord and dislocate. Though I was reading the surgeon's report of my how the operation went, and he showed me the x-ray that I had 2 weeks after the operation, and the joint is pretty tight. The capsule where my new implant is pretty close and tight, so the risk of dislocation is only going to come from a blunt force trauma. It's not going to come by just sort of crossing your legs. The approach that the surgeon used was the Bauer approach, so he cut through my gluteus medius, which is the muscle in your bottom, and that lateral approach actually has gives you a tendency not to dislocate. So you shouldn't really have any troubles in that. But there's just that sort of irrational fear you're given that by doing the wrong movement, your leg is going to somehow dislocate.